Yeah, exactly.
Okay, everyone, welcome. Happy Sunday afternoon. Hope the practice practical went well yesterday, and that your studying is going well. So today, what we're going to do is we're going to go through the past 4 years. I know I said 3 years initially. I'll tell you why 4 years in a moment. So we'll do the 2012, 13, 14 trunk exams, and then last year was the first year that she did the separate back, thorax, and abdomen pelvis exam. So we had just abdomen and pelvis. Now, the reason why I tried to throw in the 2012, just to preface this, is one, some of the images are just pretty low resolution and kind of crummy in the 2014 one. So if we're going to just kind of muscle our way through that, that might not be all that helpful. So I threw the 2012 one just to get some extra practice. These should go fairly quickly because we're not going through all these sequences. We're just sort of looking at still images. And the 2012 one actually is a little bit challenging. So I thought that would be a good one for us to hit if you haven't hit it already. For those of you that have done some of these old exams already and have looked at this, that's fine. Use this as an opportunity to see how much you've retained and how much you can sort of argue for as we're going through. And those of you that are doing this as a first pass, well, that's great. That's why we're here. We're going to work through these together. So the first thing that I wanted to do before we start them, I'm not going to go through all these slides. These I picked out just as images to go along with structures that I found in these 4 exams that I thought could be particularly difficult. Most of these are taken from the abdomen or pelvis little review that we did already. So if you've looked at those or you came to the sessions or watched them, then you've seen them before. The thing that I just wanted to mention is in this image, because we didn't talk about it last time, so I just want to spend a moment to talk about it now. Okay, so everyone knows we're looking at the pelvis. We can see this as superior view, but we can kind of tell that this kind of looks like this would be some kind of part of maybe what used to be a vertebral body. They say this is the sacral canal, so we're in the sacrum, but this is kind of that larger structure that sits anteriorly on the sacrum. And we can see pretty clearly that this would be the makeup of the pelvis. So here we have the ilium here. And then we know that this structure that surrounds what would be the rectum and the anus is what muscle group? What do we call this? Levator ani. We've seen that in a lot of the sequential imaging, right? Where we get sort of pretty low down and we've been following the rectum as we traverse down. And we see this kind of triangular muscular structure arise around the rectum, and we say pretty confidently that's levator ani. The other structure, the other name that was given in some of the sequences was pelvic diaphragm. And I sort of ignored it, we sort of ignored it, but it does come up on one of the images, so that's why I want to bring it down. The pelvic diaphragm really refers to the levator ani with this muscle here, the coccygeus muscle. And they can either be talking about just kind of the makeup of the pelvic floor that these two muscles do together, or it can be talking about sort of the interface between coccygeus and levator ani. And so we're going to see one of the images that we look at, the answer, we're going to look at something, we're going to see, well, that kind of looks like what levator ani would look like. It looks a little funny, it's a little more lateral than I would have expected levator ani to be. And what the answer is and what they're going for is the fact that this whole thing makes up what's called the pelvic diaphragm. Now, I've seen levator ani far more than I've seen pelvic diaphragm, so don't let that sort of throw you off, but it'll make sense when we look at the actual sequence, or when we look at the actual images, but just be aware that the pelvic diaphragm is a potential structure that they can ask for. Okay, that takes us to this. Okay, so this is 2012 written exams. Now, leading up to 2015, they had their first exam was just called the trunk, so it made up back, thorax, abdomen, and pelvis. So we're going to weed through some things, but this is pretty clearly before we even talk about any of the structures. I just want you to take a moment and read the question stem, number 31. Let's just read this. Okay, so they tell us some important pieces of information. One, it's an axial slice. We didn't know that already. And 2, we're at the level of S5. So are we thinking abdomen or are we thinking pelvis? Pelvis. We're thinking pelvis by this level. Okay, so that gives us the start of a list of structures that we're going to see. And now we know, okay, we're in the pelvis, and We're looking at axial image. What are some things that we already know that we can start to expect to see? And then another thing, which isn't so important here, but is very important to keep aware of, is what they say about contrast. So in both cases, the patient received intravascular contrast, and then the female patient also swallowed barium. So intravascular contrast, that's going into a vein presumably, but now that we're at the level of the pelvis, are we going to see contrast in veins or arteries? Arteries, very good. Now veins and arteries tend to travel together. They don't always do, but they tend to travel together. So if we're looking at two structures that we know are vessels, and one's brighter, now we know that's the artery of this pair. Okay, so let's look at this first one. Female. We're going to look at the structure that's not labeled, but will help us identify some things. What do we think this thing in the middle is?
Urinary bladder.
The bladder. Okay, the big structure that sits anterior in the pelvis. What do you think you could possibly confuse this with?
Uterus.
Uterus. That's one that's going to get in our way a little bit. Now, if we look back at, let's see, I'm pretty sure. Did I not? Okay, here we go. If we look back at this, which structure, uterus or bladder, sits more anteriorly? Bladder. Bladder sits way more anteriorly. We will see the uterus, and it is a fairly big structure, and depending on whether the patient has urinated or not before getting this imaging done, will determine kind of the size of the bladder. I'm going to take a guess and say that she hasn't, because this looks pretty big. But we know the most anterior structure, the one that sits most anteriorly of the two, is the bladder. So what does that make this thing, you think?
Uterus.
That would be the uterus. So the answer, I think in the answer key, is uterus, parentheses, or cervix of. But I don't think there's really anything that we can look at here to distinguish whether this is the cervix or whether this is just the uterus. But we can use our knowledge of anatomy to know, well, the uterus sits first superiorly to the bladder and then dips behind it. So that's going to be some section here. And this says it's at level S5, I think. Yeah, level of S5. So if we're looking S1, 2, 3, 4, 5. Yeah, we could start to get into vagina territory, cervix territory. Is that weird?
I don't know, vagina territory. It just sounds funny.
True. Okay. We can start to get there, but we see the size of the structure sort of makes us think it's going to be the uterus, and you would have gotten credit for uterus on there. Okay. Going back, so we go in order now. What is A? What do you think A is?
The inferior epigastric.
Inferior epigastric what? Artery. I think that's pretty safe to say that's an artery. It's a little hard to tell, but if you look at this, that contrast there looks semi-similar to this here, which they didn't ask us on this side, but they asked us on that side. So what do you think that is?
External iliac vein.
External iliac artery. Very good. So at the level of S5, we branch from the aorta into the common iliac arteries, and just a little bit down we branch again into the external and internal iliac arteries. We know the internal iliac arteries kind of move posteriorly, and the external iliac arteries and veins move anteriorly. And so we can kind of say with confidence that this would be the external iliac artery. Of these two structures, what do you think this is? The thing next to it that's not labeled.
The vein.
Yeah, I think we can say pretty confidently that's the vein. You have a question?
Yeah, so then what is that immediately posterior to the inferior epigastric?
This?
Yeah.
This is, not entirely sure. Thankfully they didn't ask us to label it. It could be, Margaret, do you have any ideas?
I don't actually.
No.
But I agree with you that that's not the. I think that the iliac artery and vein is behind that structure.
Yes.
Because
so I think this would be the external iliac artery here,
Yeah.
and this would be the external iliac vein. To be honest, I don't know. I don't really know what that is. And thankfully, I assume Stern didn't either because he didn't ask us to label it. So you don't for that. Good question. Okay. What is B? What is this thing here? First off, what kind of structure do we think this is? A muscle?
Muscle.
It's a muscle. What is it?
Pyramidalis.
Pyramidalis. Very good. Does everyone have a pyramidalis?
No.
No. So you may or may not see it. But it's this muscle here. So that makes these two things that they didn't label. But what are they?
Rectus abdominis.
Rectus abdominis. Very good. Okay.
I have a question.
Yes.
Sometimes they ask you to label linea alba, so how do you know that's pyramidalis and not linea alba?
That's a good question. Okay, so if linea alba, that's actually a question that came up in the 2015 exam. Linea alba isn't a muscle, right? It's a kind of connection of the tendinous sheaths that both muscular sides of the abdomen come together and make up, and it's kind of that line in the middle, right? So I'm looking at B, and I say it's pretty confidently looking at this structure that moves around like that and is separate from this structure here. I can see that black line, and this structure here, I can see that black line. So I'm pretty sure, and these two densities are the same, right? The density of B and then the density of these two things. They're the same. So I'm pretty confident that's a muscle, which means it's not linea alba. What they could do if they wanted to be tricky is they could probably, it's hard to do it on here because linea alba is going to, piramidalus is going to shoot up and point to it. But if they wanted to, they could probably point to something like that on this side. And ask what is the structure, what lies here, that kind of thing. And it would have to be pretty much in the midline. You'd have to see the rectus abdominis kind of do its kind of curve down into each other like that, and that spot where they meet would be linea alba. Does that answer your question? Okay. All right, very good, very good. Moving on. D, what do we think D is?
Ovary.
D is an ovary, very good. This is a little bit tough to see because we don't see the fallopian tubes leading into it. We probably would if we were going through some sequences here. But we see the structure here. It's more similar, in my opinion, in density to the bladder than it is to the uterus or the cervix of the uterus. Can someone tell me why? I mentioned it in the last section. Good, there's fluid in it. The quick answer is to be, well, the radio densities are the same, or the water density of these structures are the same. But yeah, ovary is filled with these little kind of like fluid-filled vacuoles. And so the density and the appearance on imaging tends to be more similar to the bladder than it does to the uterus. Good, okay. And now we're going to move down here. We did E already, E was the uterus. Now we're looking at this structure. They didn't ask us to label it, but what am I pretty confident this structure is down here?
Rectum.
Rectum. I'm pretty confident that this sort of muscular E structure sitting all the way posterior just in front of the bone is the rectum. Now this thing here, and this is why I brought it up in the session, this looks like it could be linea alba, but it's sitting, I don't know, it's sitting a little far back for my liking. When we saw it before, the rectum was a little bit more centered in the
So you said linea alba, but you mean the pelvic diaphragm?
pelvic diaphragm, sorry, what did I say?
Linea alba.
Ah, you made me say linea alba. So it's sitting a little too far back for my liking, and so this answer, I'll just give it to you. The answer for F is pelvic diaphragm, and I think we can sort of imagine that if we look back here. Because if the rectum is going to sit approximately here, maybe a little bit back here, levator ani is going to be kind of around this way, so a little bit more centered, whereas coccygeus and the interface between levator ani and coccygeus is going to be a little bit more lateral and a little bit more posterior. Does everyone follow that? So I look at this image here and I think, all right, that's sitting a little bit more lateral and a little bit more posterior than I've typically seen for levator ani, so I'm going to say F is pelvic diaphragm. Any questions on this?
If you said coccygeus specifically, would you still get credit?
I don't know the answer to that. My guess is going to be no, because it wasn't written as a possible choice. It didn't say like pelvic diaphragm parentheses levator ani / coccygeus. It just said pelvic diaphragm. That could be something that you could argue if you wanted to.
But coccygeus isn't part of levator ani.
No, it's not.
And it is part of the pelvic diaphragm.
Yes.
And they wouldn't give us credit for that.
I don't know. We don't grade the written exams. You could possibly argue for it if you were really clever and wrote coccygeus. But if you're so clever that you're thinking of writing coccygeus anyway, maybe include pelvic diaphragm in that thing. Be even more clever. Okay. Any questions on this? Okay. Moving on to the male. Okay. So let's do the big structure first. That sits in the middle. H. What is H?
Urinary bladder.
Urinary bladder. We're at the level of S5, which tells me I'm going to expect to see some unique structures to the male pelvis as opposed to the female pelvis. I'm not entirely sure which I'm going to see yet. I'm not sure if I'm going to see seminal vesicles. I'm not sure if I'm going to see prostate at that level yet. I'm not smart enough to think about that. But what was the thing that Margaret said seminal vesicles look like?
Bow tie.
Bow tie. What does this kind of look like?
Bow tie.
Bow tie. So what is L? And let's be specific about size just to be safe.
Left seminal vesicle.
Left seminal vesicle. Very good. Okay. If this is the left seminal vesicle, this would confidently be the right seminal vesicle. And I see this kind of little bulby structure that sits kind of at the medial spot of the seminal vesicle where they meet. What do we think that is?
Ambulant. Yeah.
Ambulate. Oh, you did that appendage. Yeah. Okay. that was good. I may have contributed to that structure on there. So yeah, ambulate. That'd be very good. It just says vas deferens, but we know that the vas deferens come from the testes and they kind of move up the lateral side of the bladder, go posterior, and then dip into the medial aspect or in the midline where the seminal vesicles meet. And I see this separate structure here. So if you said ampulla of vas deferens, I'm sure they would give you credit, but I think they were just going for vas deferens here. And we did see one of these, or we saw what he thought it was because he put a question mark next to it on one of the sequences. But can everyone see that would be? Can everyone see that kind of bulbar-looking thing right here in the midline? Yeah? Okay. Good. Let's see. Moving back up a little bit, just to make sure we cover everything. I. What do we think I is?
Left rectus abdominis.
Yeah, rectus abdominis, left rectus abdominis. What do we think G is?
External iliac artery.
External iliac artery. Very good. Now this is a little tough to see because I look at this and this is logistically tough because I see this line and then it kind of blends right into the structure. So for me, I sort of lose a little bit where the line ends and the structure begins. But thankfully, things are pretty symmetrical here. So if I just do a cut down the middle, I look at the other side. I'd say, okay, that's pretty much, I think, the structure that they're going for on the other side. It's running with this other structure. One slightly brighter than the other. I know the artery is going to be brighter. And I know what moves anteriorly are the external iliac arteries and veins. So I can say pretty confidently that that's external iliac artery. Everyone agree? Good. K, what do we think K is?
Rectum.
Rectum. K is rectum because we were looking at a pelvic slice, and what we determined was if we're looking at a pelvic slice, they're probably going to be asking for rectum. And we're also at the level of S5, which is about where the change from sigmoid colon to rectum happens. Any questions on this?
This is not a question, but just a thought about what that thing that we couldn't figure out what it was might be. It could be an inguinal hernia.
Ah,
So that could be bowel, especially since they bothered to tell us that she is swallowed barium.
very good.
I mean, I don't know if that's what that is. There's just
Very
a
good.
possibility.
I was wondering about that.
There also should be some reason that she's getting an MRI in the first
Just may
place.
not have
or
done. I mean,
CT in the
because
first place.
first of all, if it's an inguinal hernia, that's going to be small intestine, right? So the barium may not have gotten to the colon yet at all. It might just still be in the small intestine. That may not be what that is, but that just is a possibility of what it could be.
Okay, any questions on this? Okay, I think the next one. Yes, okay. So this is a pretty tough one for two reasons. One, it's tough because this just didn't print well, in my opinion, so some of these things kind of just look like a mess. But it's also tough because we have a lot of information thrown at us. So we're going to do the thing that we do for everything, and before we even look at the imaging, we're going to read. And you're going to wonder why I'm harping on this, but it comes up each time where they might give us some clues as to what we're looking at. They might give us some information as to which way we're moving in the body. And particularly, if the same thing is labeled multiple times, or we have to give the same answer multiple times, that makes us really uncomfortable to answer the same thing for multiple times. But sometimes that's what they're asking for. So we're just going to read this just to be on the safe side. So. Below, a number of sections from MRA. Section 1 is the leftmost. Section
What's an
21.
MRA, Mike?
Oh, magnetic resonance angiogram or angiography. So what's going to be highlighted in them? Vessels. Yeah, vessels. Specifically, what type of vessels?
Arteries.
Arteries. Yeah, generally arteries. Most of the time, it's arteries. I think we've seen 1 or 2 MRAs on going through the sequences. Let's see. 21 is the rightmost sections. Sometimes the same structure has been labeled in more than one sections. Other times, a structure appearing in multiple sections is labeled only once. Identify the labeled structures and state left or right where appropriate, and they will take off points. If they put that in there, they will take off points. If you are looking at a symmetrical structure such as the renal arteries and you don't specify left or right. Okay, we can skip some of these because pretty much anything above that area is thorax, and not that I want you to forget all the structures in the thorax because you're going to need to remember them for the final, but we're not going to take time now. If you want to go through that, you're welcome to go through that on your own and send me any questions that you might have. But the first thing I want to look at is this structure C, because I actually think this is a fairly confusing image, so I want to see if we can reason through some things. So C, we know that we are at the left, so the first one is the leftmost. We know we're sort of posterior, so what's sort of a structure that sits on the left side of the body, pretty posterior?
Spleen.
The spleen. Okay, so I look at this and I think, well, why the hell is it surrounded by all this bright stuff? And I don't have a great answer for you other than this person is lying on their back, and they most likely have swallowed. We know that they have stuff in their arteries, but they may have also taken up some other fluid in there, like maybe they did a barium swallow and they didn't tell us, maybe they did something else. So this could just be stuff surrounding the spleen, but this structure C that it's looking at, that is pretty confidently the spleen, if for no other reason than we were all the way most to the left and we're sitting pretty posterior. Does everyone follow that? Does anyone have moral objections to that? Okay. Well, what sits slightly below the spleen on the left side?
The left kidney.
Left kidney, very good. Left kidney. Kidney is a symmetrical structure, so we're going to have to look at that and say left kidney. Okay, does everyone agree that that would be the kidney? Yes.
Can you see the suprarenal gland at all?
Not particularly well. I see a little something here, but not really.
You could if this were a better reproduced image, probably.
Yeah. The other thing that they could have done, which I'm glad that they didn't, but they could have done, is they could have just drawn an arrow at the superior portion of the kidney and asked to label it, and we would probably put suprarenal gland or adrenal gland, just because of our knowledge of anatomy. But I can't really visualize it on here. It's also a pretty tough image to see. But yeah, any other questions? Okay. All right, moving on here. G. I'm going to come back to G because G is a tough structure and it's a little hard to see, but you can kind of make out this sort of density around it. Anyone see a slight kind of an image there? It's a little tough. But we're going to come back to G. We're going to notice that G is in each of these pictures. Almost all the pictures, except for the last two. So let's just get we'll come back to it, but let's get our thinking caps on. What's a structure that kind of looks like this sort of thick kind of like, I'm looking at like a long pipe sort of thing, not quite a pipe, but I'm looking at something that's sort of shaped like that, and moves essentially in that same form across the body. Ooh, very good. You guys are clever. Pancreas. G is the pancreas. Okay. Let's see. G is the pancreas. G is still the pancreas. I see this structure here. Now, H is something that follows posterior to the pancreas almost its whole way through. What do we know that does that?
Splenic vein.
Splenic vein. Very good. Does anyone remember? I think I have the image here. It's a little hard to see, but if we have the pancreas here, we know that the splenic artery is this kind of tortuous thing. It makes this kind of sine wavy curve thing that sits sort of posterior, but mostly at the superior border of the pancreas. And behind that, behind the body of the pancreas and under the splenic artery is the splenic vein. Any questions on that?
Yeah.
Okay. Okay, good. So we did G, we did H. One thing to keep in mind is I would look here. Say I was going through this like this. And you may get a question like this on this exam. I don't know the radiology slides that she puts on the exam beforehand. But you could get something like this. And I look at this and I think, oh no, I have no idea what G is. I have no idea what H is. But I'm going to use the fact that they put multiple images on this question to sort of help figure that out. It's kind of like they're giving us sequences in that way. Okay, so let's see. That's still stuff up there, so I don't care about it. That's still pancreas, that's still splenic vein, stuff up there, don't care about it. Okay, what's this big structure, even though I just said that we don't care about stuff up here? What's this big structure?
Descending aorta.
Yeah, descending aorta. Good. Aortic arch, or ascending aorta, aortic arch, descending aorta. What's the first branch that comes out? Celiac trunk, very good. What's the second one?
SMA.
SMA, very good. So L is SMA. What do we think, I'm sorry, K is SMA. What do we think L is?
Left splenic, renal vein.
Left renal vein. Okay, so let's think about that. I have this picture of the kidneys here, and I know the renal arteries left and right come out of the descending aorta and go into the kidney. And then I also know that the renal veins drain to the IVC. And the IVC sits sort of to the right of the aorta. So that's easy for the right kidney, because the right kidney just has, its vein just has to go from it to the IVC. But the left renal vein kind of has to traverse a bit of a distance. It has to go all the way across the body, across in front of the abdominal aorta, descending aorta, and under the SMA to make it to the IVC. And we see that play out right here. If I know that that's the SMA, I see this thing, and it looks almost like it's kind of funny shape, but it kind of looks like a dot a little bit. It's a little oblong-shaped dot, but it kind of looks like a dot, meaning that thing's pointing in that direction, and I'm looking right at it. And since I don't see IVC yet, I can say with some confidence that that's the left renal vein.
Can we scroll up a little bit so that we can see the images, or sorry, other direction. Scroll so that we can see the images below it. Does L show up again later? No, okay.
L goes away. Does everyone follow that reasoning? Does anyone have, I'm going to ask you for your moral objections today. Yes?
So why would you say vein instead of artery?
Very good. So where would the artery be coming from?
The
aorta.
The aorta. So I would see it coming off probably pretty much in front of, or I'm sorry, not in front, to the left of, which from my perspective is in front of the descending aorta. Maybe I would have seen it here. Maybe you could make the argument that this thing here maybe is the left renal artery, maybe. But really we would see it more in line with, more in the same plane of the descending aorta. Yes?
This is a contrast question. You said that in an angiogram, the arteries are more likely to be lit up.
Yes.
That renal vein is like super bright.
Yes, it does look very bright. I agree. I don't have a great answer as to why, unless both things got lit up, or if at this point it's been in there so long that contrast has moved from arteries into the structures and then back into the venous system. But that's a good point. Yes.
Is this the normal course for the SMA? Because we talk about occlusion of the left renal vein. So doesn't it run usually more vertically instead of just straight anterior like this?
I agree, but it has to come out of.
Right, so we can still diagnose it like that, but should I be looking for a right angle like that coming off the aorta? Should I be looking for something more acute?
Yeah, so it's a little tough to see here. I mean, this person is also lying down, so maybe the structure is kind of being like pushed up against the left renal vein a little bit, or being pushed up against other things instead of gravity trying to make it fall down.
I think it's one of those things where there's just variability.
Yeah, but I mean, you have to think about the fact that it does first have to come, like if the abdominal aorta is going down this way, the SMA still first has to come out of it. So there is going to be some kind of right angleness to it before it dips down. And this actually, I kind of like this because I think this shows us very nicely the celiac trunk's relationship to the SMA. And we've also looked at coronal images where by the time we get to the level of the descending aorta, we see kind of two dots coming out in front of us. And we can say with a good deal of confidence that the superior dot is the celiac trunk and the inferior dot is the SMA. But I agree, it will very quickly make another 90-degree turn, or about 90-degree turn, and become a more vertically oriented structure. Any questions on this? Okay, let's see. This is all the same stuff. We don't care about stuff up here. We only care about these things, but G is still the pancreas, H is still the splenic vein, K is kind of hard to see. I don't really know what K is when I look at that, but I think, oh, well, K is still the same K that was there. So that's nice. Okay, moving down here. What did we say K was? SMA, okay. So I see the structure, and this is a little tough, but I see the structure that is moving vertically, and I see the structure next to it also moving vertically. What kind of travels in the same plane as the SMA?
SMV.
SMV, I agree with that. And I'm also, just to get a little bit of extra confidence on this, if I look over here, I see this big structure that's sitting, now we're pretty far right, and I see this big structure that's here. So even this is kind of a crummy image, what do I think this big structure that's sitting in the right of the abdomen is?
Liver.
The liver. Okay, what does the SMV do? Someone tell me its course to get to the liver.
Joins the splenic vein to form the HPV.
Yes, joins with the splenic vein to join the joins with the splenic vein to become the portal vein. Very good. So I know eventually it's going to be leading up to go to the liver. So I think I can say with a bit of confidence that this is the SMV. Anyone have any questions on that? Yes, you have a question? No, okay. Good. Now this is a little tough because I look at this and it almost, since we're looking at a sagittal section, it almost looks like this is sitting slightly superior, and I remember this image where I see the SMV and the SMA kind of running in the same plane, but again, there's a little bit of sort of individual variability that can happen here. They're not all that far apart. It's not like one is very much in front of the other. So there could be some just random little reason for that. But the important thing to know here, and I think the relationship thing to know, is that I see two structures moving in the same direction, very close to each other. And if we've already identified this as SMA, I can say with a reasonable amount of confidence that this would be SMV.
Why not the IVC?
Why not the IVC? The IVC, okay, if we look back here, I see the descending aorta, and it's sitting pretty far. Now again, this is kind of a tough image to look at, but it's sitting sort of just in front of and to the side of the vertebral bodies, which are hard to see, but I can sort of see bony little things jutting out here. So if I go back here, I see sort of the same thing along here. I can even see that looks like a vertebral body, and that looks like it could be an intervertebral disc here. So I would expect the abdominal aorta, which we've now passed, right? Because we're going from the person's left to the person's right, and we saw it here, and now we're past that point. I think I would see the IVC a little bit more posterior, a little bit closer to the vertebral bodies than this is. The other thing that I know, or I can guess about that, what do we think P is? P could be a Faraday's structure.
Yeah, hepatic vein.
Hepatic vein, right? So I see the structure, it's coming from the liver, and it's draining upwards, or it's sending something upwards. What's something that I know that does that? A hepatic vein, right? And what does the hepatic vein feed into? The IVC. So I could say with some amount of confidence that this thing here is the IVC. And it's sitting kind of what we expect it to, where we expect it to be. It's sitting sort of in the posterior aspect of the liver and going through the liver to get up to what structure?
Heart.
The heart, the right atrium, specifically, right? Good. So I look at this and I think, I don't know, if I'm looking at these planes here, this is sitting a little bit too in front of what I can guess would be the IVC, even though they didn't ask us to label it. Does that make sense?
So the other thing is, like, I agree with you that Q should be SMV, but
Thank you.
why? Someone might argue, why isn't it like hepatic portal vein?
Oh, why isn't it hepatic portal vein?
It is
That's-
to the liver.
It's too low.
Too low.
And it didn't meet splenic yet.
Yeah, it could be. Let me just make sure. Okay, yeah, it's SMV. That's a good question. The only answer I can give you is if we look at this image. Okay, if we look at this image, I see that this is going to be the SMV. This is the IMV. This is the splenic vein. Splenic vein joins with the IMV, continues as the splenic vein, joins with the SMV, becomes the portal vein. We all agree with that? What's not shown here, but what I can imagine, if you follow my mouse, the splenic artery would run about here, right? Okay, so the splenic artery would get to about here, which is about where the celiac trunk is. A little bit lower down is about where the SMA is, and then the SMA goes down. So at the point where you can see the SMA traveling down, you see you see SMV. By the time you see portal vein, we're now superior to the plane where the SMA would have come out of the abdomen. Does that make sense? So if we were to call this portal vein, I don't think we'd be able to see this. Does that make sense?
Yeah.
It's a nitpicky little thing, but I think if we kind of imagine the relationships of these structures, which is kind of intricate, we can reason through that a little bit. But that's a fair question to raise. Did everyone follow that? Anyone any questions about this?
And additionally, the junction of the, like where it becomes the hepatic portal vein, at least based on the image that you were looking at before, that junction is sort of above the pancreas. And so that's, and it kind of necessarily has to be sort of there. So the fact that we're so low down, we couldn't call that the portal vein. That's another way to see that we're so low down.
Yeah,
So we're well below the pancreas there.
Any questions on this?
Aren't we?
Okay, well, you guys just aced the 2012 written exam. Congratulations. We move on to 2013. Okay, 2013 is going to be short because this is all, the second radiology is all thorax. So we're not going to do that. We're just going to do this one. So first thing we're going to do, like the first thing we do for any question that we get, is we read the question set. Below, 3-axial CT scans from patient who's been administered both intravascular and oral contrast. Levels of the sections are indicated on the image to the right. Identify indicated structures. Okay, so I gave you a, on the practice pinning, one of the radiology slides look at one of the questions was a really ugly set of images in my opinion. But the reason why I gave that one was because it had at the top left, it had a sort of roadmap to where all those slices were. And if you're given that, use it, because those can really help you identify what level you are, and based on what level you are, what structures you expect to see. Because at one level, we expect to see celiac trunk, but then at a slightly different level, we expect to see SMA. So depending on where we are determines what the structure would be. So I see 1 is up here, 2 here, 3 here, and that corresponds then to the axial slice that we get here. Okay.
And
So-
may I add, in addition to just noting sort of what general level you're at for each one, like it also is great to help you see how far apart they are with relation to each other, which is also very useful. Anyway, yeah, those things are the best. I love them.
Yeah, so these things are pretty close to each other, so we're looking at fairly close structures. Okay, so I'm going to look at this one first. Anyone take a guess as to what A is? Splenic artery. Okay, why do we think it's the splenic artery?
It's got a weird torture.
Yeah, it's doing this kind of weird turn thing, and it's also, we're looking at the highest structure. We're looking at the highest slice on here. So I may have been tempted to say splenic vein, but I also may not be quite far enough down to be splenic vein yet. So knowing that, and then the combination with knowing it does this tortuous thing, meaning it does this kind of windy turn thing, I can say with a pretty decent deal of confidence that this is going to be splenic artery. Anyone speak now or slightly hold your teeth? Yes.
As like an added thing, you can also see it like coming off the aorta.
I agree. You can see this thing here. I agree. What is this thing? Celiac trunk. And it makes kind of sense if we're at about this level, that would be the celiac trunk. Very good. Very good. If that's the celiac trunk, they didn't ask us to label it, but what might this thing be? Yeah, common hepatic artery. Very good. It's not, they didn't ask us to label it, but I can say with a pretty decent amount of confidence that if I know, or if I can prove that this is coming off of here, the only thing I know that comes off the common, that comes off the celiac trunk and goes to the right is the common hepatic artery. The other two things, splenic artery, and maybe that's a little bit of left gastric artery, but that's hard to see. But those both go to the left. Agree? Nah, I don't care if you agree. No, okay, yes, good. Good. Okay, now this is a little tough. B is a little tough. I see this thing, which he told me that this was a structure, but I don't see much else here. But then I see this come into play once I move just a little bit farther down. What is this? This is the right kidney. What does that make this?
Suprarenal gland.
Yeah, suprarenal gland, right suprarenal gland, right adrenal gland, whatever you want to call it, it's the same thing. It's on the right side. You have a question? Yes.
Is there, I can't remember the telephone like this, but with the, like, there you go. Would that be like a vein?
Oh, would that be the vein? I don't know. I think this is a little tough. The answer is gland. Right, the answer is gland? Yes, the answer is gland. I think that the arrow sort of obscures it a little bit. I think if this wasn't here, maybe we'd be able to see more of the Y shape to it, but I do see a little bit of an angle there. And then I know once we go down just a little bit further, we start to hit the top part of the kidney. And I know what sits on top of the kidney is the suprarenal gland. So I'm going to say pretty, what?
I could find it, right? Varicose vein. Just because I do see like a
No. I don't know. Marvin, have you ever actually seen the suprarenal vessels on imaging? I don't know if I have.
Not that I recall.
Not that
I feel like
recall.
it's come up in not on imaging, but in like written questions.
Yes, I agree on that. That's one of the structures that I agree that could be there also, but I don't know that I've seen on imaging all that much, unless you're doing like an angiogram of the kidneys. But I don't think that I've seen that. What I think they're going for here, if they're testing you on relationships, is the fact that the suprarenal glands sit superior to the actual kidneys, and then if we move down just one slice, we see not much farther down, we see the top part of the kidneys. So I think that's, in terms of relationships, what they're going for. Does that make sense? Oh, do you have a comment?
So when we go to the side of the kidney, but not to the top of the kidney another way, according to the law.
Yeah, that could be it. I'm going based on my gut instinct. My gut instinct tells me, all right, I know, but I've gone through enough imaging to know now that as I'm moving down in an axial slice, I see the suprarenal glands first, and that makes sort of sense. Do you have a question?
Yeah. What we said the two circles in between the common hepatic.
Say that again, I'm sorry.
The two big circles in between the common hepatic.
Above and below it, yeah, so two big ones.
Oh, these two big things. Okay, so this is a little tough. We'll see this come up in other imaging. This would be the IVC, and if we were going up, if we're going north in the body, we would see it kind of just feed into the rest of the liver. This is a tough structure, but this is actually the portal vein. If they didn't ask us what it was, but if we look at this, eventually the portal vein does start to kind of like jut. It's still at an angle, but it is kind of going north a little bit. And I think if we look here, we can see the portal vein sitting. So if this is celiac trunk, this is common hepatic, this is proper hepatic. This thing here they labeled as portal vein, and this thing here they labeled as IVC, meaning the portal vein sits anterior to the IVC. And we even kind of see the suprarenal gland on the side, and so we go back here. If this big structure, that makes sense, and then that's the IVC, and then this is kind of where the portal vein stops going, sort of moving to the right and starts to move up a little bit. That's a tough structure. I think we actually do have that question later on, where they ask us to identify that, but that's a good question. Does everyone follow that? Yes.
So the little squiggly line though in between the two structures, if that's the hepatic artery, doesn't the hepatic artery run anterior to the portal vein?
I agree with that. This could be just some individual variability in this individual. I'm going based on my knowledge of anatomy, and that the thing that comes from the celiac trunk and moves to the right is the common hepatic artery, which then gives off, once it branches down to gastroduodenal, then it becomes the proper hepatic. So I think if they asked us to label it, I could make the argument based on that, but also thankfully they didn't ask us to label it.
But why wouldn't that be? Oh, gastroduodenal would also be anterior to the hepatic portal vein.
Yeah, and we would also see it. I don't think we would see it in this slice, or we might see it as like a dot because it's going to have to start to move south. Yeah.
Did you mention when you were talking about the suprarenal glands, the fact that in this particular image it's fat suppressed, so things that are fatty, like a suprarenal gland, are going to be harder to spot?
I did not.
So that's just something to pay attention to when you're when you're looking at imaging. Take a look and see. Yeah, before you even start to look for stuff, just like, can I see fat or can I not see fat? Because if you can see fat, then that might help you find some structures, and if you can't, that might make certain structures harder to find. So.
Yeah. And when she says look for fat, look at the subcutaneous fat.
Exactly.
Here.
Precisely.
Around this person. It appears black on here, so that's very good. Actually, that's a very good way to think about that. Good. Okay. Moving on. C. I think C is a little tough, but they said that the patient was administered both intravascular and oral contrast. So I know that the stomach and the small intestines are going to be lit up a bit. So I look at this structure here. I see some possibly air in there sitting in the anterior portion, and then I see it kind of taper a little bit and then go into this structure. So what do I think, just backing up a little bit, what do I think this structure is here?
stomach.
Yeah, the stomach, and if they wanted to ask us specifically, maybe we could say antrum of the stomach, but they didn't even ask us to label it. But it's good to know because we know that the stomach tapers a little bit and then moves into what structure? Yeah, the duodenum. And they didn't ask us to be specific on here, so we can just say duodenum. Does everyone agree? Good. If we saw a celiac trunk there, someone pointed out the fact that this would be the celiac trunk, and now I move a little bit further and I see another thing jutting out of the anterior portion of the descending aorta. What do I think E is?
SMA.
SMA, very good. Now, I've identified A as splenic artery, so what do I think D is? About the same spot and a little further down. Splenic vein. Anyone disagree with that? Very good. Okay. Now, here's where things get a little bit confusing, but I think we can definitely reason it through. I see these two structures here. I'm now down at this level, so I'm down a little bit further. SMA has already come off, and I see these two structures. We're going to see this image a lot, so I want to just kind of give it away a little bit. These two structures are these two structures. Once we move a little bit down, the SMA does that dip that we knew it was going to do, and it moves south. And when it does that, it's moving in the same plane, and then sort of the blood's moving in different directions, but it's going in the same direction as the SMV. Now this is a relationship that's going to come up a lot. Which one do we think is the SMV and the SMA? What do we think G is?
SMV.
SMV. Why is it the SMV?
Right side.
It's more to the right, right? And why does the SMV need to be on the right? Yeah, it needs to, it's going to meet up with, well, first off, it's draining structures that are sitting in the right of the abdomen, but also, just from our knowledge of where it goes, it has to meet up with the splenic vein and then move to the right even more as the portal vein to go to the liver. Now, if it was on the left side, it would have to do this weird crossing over, which does happen. We do see structures do that, but it's not as common for that to happen. So this is going to be SMV. This then is going to be what they didn't ask us, but what is it? SMA, very good. Now, if we look here, and this is something we spent some time on when we did abdomen, I see the pancreas moving sort of anterior here. The neck of the pancreas is anterior to the SMV and the SMA. The head does this dip around, and then the uncinate process sits behind the SMV and the SMA. Uncinate, whatever. That thing
Be specific.
sits behind the SMV and the SMA. This is going to come up a lot, so I want to think to ourselves, well, if I know that's the SMV and I know that's the SMA, they didn't ask us, but what's this thing sitting behind it? This thing right here. This would be the uncinate process. What does that make F? Head. Very good. I don't think they asked us to be specific. Maybe they did. Oh no, what the answer key said, the answer key says pancreas and in parentheses head up. So you would get credit for both. They don't ask you to be specific, then you would just get credit for the structure. Very good. Okay. What do we think I is? Left renal vein. Okay, what did we identify? They didn't ask us, but someone very cleverly decided they wanted to find out what these two structures were. And we determined, well, that's the IVC because it's sitting about where the IVC should sit. And this is the portal vein because I know the portal vein sits anterior to the IVC. And then, okay, that's still about the same spot, so I have no reason to think that isn't still the IVC. And then, that's in the same spot. So I'm pretty sure that this is the IVC here. And I know that the renal veins drain into the IVC, and I see this big structure coming anterior to the descending aorta, coming from the level that the kidney would have been, right? The kidney's here. So this is kind of coming to the level where the pelvis of the kidney would be. And sitting behind the uncinate process. Now they don't show us, but if I know, so here's a kidney here, here's a kidney here, there's the IVC, meaning this kidney's vein has to go across to get to the IVC. If they don't show it going in front of the head and uncinate process of the pancreas, I can say, well, I know it has to go through there, so my only option, or the only option, is that's going behind it. And that sort of makes sense here. That follows, where I see it's going in front of the abdominal aorta, it's going across, it's going behind the head of the pancreas and the uncinate process to meet with the IVC. Does everyone agree?
Yeah.
Cool. What is this? This is a little hard to tell. It's gonna be easier on this. What do we think these things are? Not arteries. These kind of they're a little too big to be kind of like intercostal arteries or lumbar arteries at this point.
Can you see lumbar arteries on these things?
I think you can actually. I've seen some images where you can, but they're very subtle. None of the images that we've gone through together have had them. But you can if it's a good crisp image. What did we say was this kind of muscular structure? Diaphragm. And so specifically, what would this be?
The right cruise.
Right cruce of the diaphragm. Left cruce of the diaphragm is a little hard to see. You can kind of see them here, and you can definitely make them out here. Does everyone follow that?
This is a really good example of an image where, like, when you're looking at, wait, is this not on anymore? No, it just died. When you're looking at H, you look at that and you're like, what is that? I can't tell. But as soon as you look at the sequential images above it, you can figure out, you can say like, oh, I recognize that in the far left image there. And so that's a really good, like, when you're lost and you've got sequential images, absolutely make sure that you look at the adjoining images.
Yeah, and so someone mentioned the possibility of lumbar arteries, which is not an unreasonable assumption because you can look at this and say, well, I sort of see that this is coming out of the area of the abdominal aorta. But if we look at this, this would be the sacrum, this would be L5, 4, 3, 2, 1. Yeah, we're getting in the lumbar region, but we're still, if I can see this pretty far up, we can still see ribs here pretty far up, then I don't know if those would be lumbar arteries, and it's also pretty big for what a lumbar artery would be. Yes?
Would the right renal artery be running under the IVC like that?
Right renal artery. Yes, I think. Before I tell you the wrong thing.
Yeah.
Yeah, so it would. So you were saying that you're asking that because what's the possibility that this would be? Yeah. So if we look at this here, if you look at the kidney, this part of the kidney is called the pelvis of the kidney, and we see that the vessels feed into the pelvis of the kidney. So I go back here. And I think, okay, I'm seeing, we're a little farther down. I'm not sure what part of the kidney I'm in, but I don't see anything really going into it. So I think that's not quite the level of the pelvis, whether we're too far or we're too high up. We're not quite there, but we do see this thing jutting across. And this almost looks like, maybe as a better answer, this almost looks like it's pointing down. Not sort of doing the across thing that we would expect it to. And I think we have seen, I think we did some of the sequences where you could see the right renal artery jutting under or jutting posterior to the IVC. But I think we see it much more intentionally going from this structure to that structure than doing this dip downward or doing this dip posterior. Does that make sense? Any questions on this? Okay. You guys are doing a great job.
Oh,
This
wait,
is
I have a question.
what?
I had a question.
Yes.
I don't know if, I hope you didn't already answer this, but the two dots, the pairs of white
This?
dots on the left and right anterior lateral.
Here, do you want to,
Is that point
if
working?
that works? Yeah, it's working now.
Here.
Oh.
Are these the flexures of the transverse colon?
Oh, that's a good question. So that could be. This structure is pretty competently the spleen here. So that could be the splenic flexure a little bit. It could still be some part of transverse colon.
Does that also make sense because the splenic flexure is at a different level, right? So the fact that these are different sizes would make sense.
Yes, because
Yes.
you can see all the way on the left-hand side, I think you can
Is
already
that-
see that. No, but over,
This.
yeah. I mean, I think you can, I think that those are, yeah, the splenic and hepatic flexures, I think so.
Yeah.
So what, is this same thing? 'Cause
No.
it's-
So this is
right?
duodenum.
So what is this?
This, I imagine, could be some part of potentially the ascending colon making its turn to become the transverse colon. I'm not entirely sure, but that's what I would guess.
Is that not the hepatic flexure?
So that would be the hepatic flexure, yeah, the essence. And the reason why I think that that's not duodenum It's tough. The reason why I think that's not duodenum is because it's making this kind of big pocket thing. And what are those big pockets on colon? What are those called? Postura, right? Whereas I look at this and it looks fairly smooth. So I think that these are different structures.
So my last question is just like, if this is here and then it reappears over here, where is it here?
I don't know.
Okay.
It just the way they did the slice, it just got cut off.
Okay.
Yeah.
The colon.
Yeah. It just the slice didn't go to it. Maybe I don't know.
No,
Yeah.
yeah, okay.
If we're seeing a hepatic fracture, shouldn't we be seeing a gallbladder though also?
Maybe this person doesn't have one.
Maybe they don't have one. This looks like I don't know the answer to that question. The thing that I would keep in mind, you're asking great questions, but if they didn't ask us to identify the structure, there could be reasons for that, such as this came from someone with some certain pathology, and we're just using these images for certain structures, but not for others. I don't know, I'm not going to say with confidence. They asked me to label this, and they said be specific. I'd say hepatic flexure, because I don't know what else that could be, but thankfully they didn't ask me to label it.
One reason it's, I think, pretty definitely not the gallbladder is that, is that you've got that air pocket there, and then you've got like really high contrast stuff, and we know that they've taken oral contrast. So I think that it's pretty clearly not gallbladder.
Oh, no, this thing itself is not gallbladder.
Yeah.
No, this maybe, I don't know. You can usually see the gallbladder pretty clearly on there, but yeah. Any other questions on this? No? Okay. Congratulations, you just aced the, what was that, 2013. You guys are doing a great job. Okay. It's 4 o'clock, so I'm going to vote because many of you have said how exciting these are, that we take a 5-minute break. We will start up again it's 3:58 now, we will start up again at 4:03.